Hi, this is Mary Colbert with Divine Health Podcast with Dr. Don Colbert.
Hey, I'm Dr. Don Colbert, and we're excited. We're talking about acid reflux, and we are seeing an epidemic of acid reflux. You know, if you have it, you get those acid burps, you get the heartburn, the indigestion, especially at night if you have that big dinner, and especially if you have that dark chocolate. It relaxes that lower esophageal sphincter, and that acid creeps up, and all of a sudden you've got heartburn.
You know, Don, I didn't realize that acid reflux can actually be dangerous.
Oh, absolutely, Mary. Acid reflux can actually cause a stricture in your esophagus. It can cause bleeding. It can cause esophageal cancer from a Barrett's esophagus. So again, this is critically
You
important.
don't want to just ignore if you have acid reflux and you just think, oh, well,
Oh, well, that's no biggie. No, you're
No.
signing up for all kinds of
Yes.
complications with acid reflux and potentially esophageal cancer. And that's one of the worst cancers you can have. That's a deadly cancer.
And that's crazy. It is associated with acid reflux.
Oh,
That's
Mary,
nuts.
we have more than 60 million people in the U.S. have acid reflux, and it's increasing.
Because people have a big fat belly.
Well, yes, you're right. The acid reflux epidemic is following the obesity epidemic, and now over 40% of Americans are obese. And the more belly fat you have, generally speaking, the more reflux you will have. It's very simple. And I tell people this, I've known this for 35 years, because 35 years ago when I did my OB rotation, and I delivered like 50 babies in 3 months. Well, what I found is once women got about 6 months pregnant, most everyone developed acid reflux. We'd have to give them Malox or Mylanta or something that wouldn't hurt the baby. We couldn't put them on proton pump inhibitors or anything. And so then, or we'd elevate the head of the bed, and I would control their reflux. Well, the similar thing is happening to Americans. Because once you get that belly fat, and you're carrying like a 6-month pregnancy of belly fat, and it's like a watermelon on your tummy, then it pushes that stomach up through the diaphragm. Many people get a hiatal hernia effect, and they get acid reflux. And that acid reflux is worse, we know, with the increasing abdominal girth, but also there's so many foods that make it worse. There's so many people trying to fit in girdles and Spanx. The more Spanx you wear, the more reflux you're going to have. And now we have Spanx for men. So Spanx is big business, and it's causing an epidemic of reflux. And some women are putting double Spanx on. I remember this one friend of yours years ago.
I know.
Went in and tried a Spanx on. She couldn't get it off.
They had to cut
They
it
had
out.
to cut it off her in the store. And that
I
was
remember
funny.
that.
And
That
she
was-
says one time she got a Spanx on, and she says she tried to get it off, and it slingshotted across the room. And so we've had so many Spanx stories from patients over the years, but
I know that's funny, and that's all in humor, and we all want to laugh about that. But you know something? This is serious. That reflux can be so deadly, and yet it can be so simply corrected, so easily corrected. One, by putting a knife at your throat.
Don't put a knife at your throat, please. That's what it says in the Bible
I
and
know.
Proverbs.
It's an expression of kill your appetite. Just get in control of your appetite, because that is really what you need to do. You need to exercise restraint against eating too much, because you're bringing that harm to your body yourself. And I know we all go through seasons where we kind of get loosey-goosey with it, but you don't want to do this long term, because long term you really pay a high price.
Well, Mary, let's just talk. Most doctors treat acid reflux with medication, and they use these powerful proton pump inhibitors like Nexium and like Protonix and like Prilosec, the little purple pill. You hear that all the time. Well, what are you taking? It's the little purple pill. That's what I'm taking, because it turns off my acid.
No, but turning off the acid is not such a good
No,
thing.
listen to the side effects. These are
Gee.
side effects of proton pump inhibitors like Nexium, Prilosec, Protonix, all of these proton pump inhibitors. You have an increased risk of stomach cancer. This is in the literature. We know this. When you take proton pump inhibitors long term, you increase your risk of stomach cancer, kidney disease. How many people have kidney disease now? And that's also caused from high blood pressure, high blood sugar. But now proton pump inhibitors can increase your risk of kidney disease. Once the kidneys are gone, they're gone. Then you got dialysis. You don't want to do that. Bone fractures. Listen to this. When a person's on a proton pump inhibitor, it causes your body not to absorb 4 key nutrients that are critical for bones and energy. Number one, when you're on that proton pump inhibitor, you don't absorb adequate amounts of vitamin B12, so your energy starts to suffer. You get tired. Number two, calcium. It inhibits absorption of calcium and magnesium. Now, calcium and magnesium are real important for your bones, but magnesium is real important for sleep. It's real important to prevent muscle spasm and leg cramps and eye twitches. How many of you are out there with eye twitches and leg cramps in your calves at night? It's because your magnesium is low, and many times because you're taking a proton pump inhibitor. Also, another mineral that's lowered is iron. When your iron gets too low, now I check a ferritin on every patient because ferritin is a measure of your iron stores. And so many women under 50 have low ferritin levels, and when your ferritin is low, you get tired. Now, so many men, because they eat so much red meat, their ferritin's way too high, and too much iron can cause plaque in your arteries. So again, we want a balance. We want just enough ferritin, ideally around 100. And once that ferritin's, so I check it on everyone because in women, younger women, I find low ferritin. In older women, and older men, I find high ferritin. So again, we've got to get a balance, and too much red meat is going to make your ferritin too high. But what we're talking about is when you're on these acid-blocking meds, it lowers the iron counts in both men and women. Now this is kind of amazing, but this other problem we find with these acid-blocking meds is dementia. Actually, what they find is increase in dementia and in Alzheimer's disease in patients on long-term proton pump inhibitors.
Whoa, Don.
Most people don't know that, Mary.
Don, wait a minute. When I sit here and listen to all this, and I'm thinking, all of this is being brought on because of belly fat.
Yeah, exactly.
This
So
is
we got to
nuts.
back up, and the doctors and the drug companies, the drug companies are making a killing because they do stop acid, but it doesn't correct the problem. The problem is in your lower esophageal sphincter, a little muscle that is popping open and allowing the acid to flow up because of your belly fat generally.
The pressure from the fat pressing in on it.
Exactly. And so what happens is that little valve is not functioning properly, and it's not an acid problem. It's a lower esophageal sphincter, which is a muscle problem, a valve problem that's not functioning properly. But what's happened is the pharmaceutical companies have a patient for the rest of their life. They want to keep you fat. They want to keep your belly fat, so you'll keep on their medication, which is in turn increasing your risk for osteoporosis, osteopenia, dementia, kidney disease, and low energy from low vitamin B12 levels, and even stomach cancer.
Don,
Is this crazy?
This puts a whole nother meaning to the scripture. It says, my people are destroyed for lack of knowledge.
Amen. So let's talk about it. You know the symptoms. Most people know. So let's just talk about what to do for acid reflux. Number one, lose the belly fat. How do you lose it? Real simple. Read my book, Beyond Keto. It's my new book. It teaches you how to burn the belly fat off. The cool thing about this book, that's a Mediterranean keto diet, you generally burn belly fat first. The belly fat literally starts to be burned as fuel.
Because it's similar to keto, which is what keto does. But the
Right.
problem with keto is that you can't live there. You
Right.
can't stay on
You can't
keto
stay on it for
long term.
well,
and
yeah.
that's the problem with keto.
Well, only 20% of patients can do it long term.
Right.
And so 80% can't. You're
Can't.
right.
That's right.
That's according to the stats.
And that's why Beyond Keto this book is so important, because
Exactly
this is,
right.
the variety of food is there, all kinds of amazing information is there, that this is something people really, really, really can live on.
Okay, yes. Now, people are saying, well, why did this all of a sudden happen? Most commonly, it's because of too much belly fat. Just think of taking a hot water bottle and setting a watermelon on top of it. What's going to happen? Water is going to leak out of that hot water bottle. And that's similar to what's happening. That lower esophageal sphincter that's supposed to be closing off is popping open, especially. So let's go over the main triggers that do this, that cause this sphincter problem. Number one is your weight, especially your belly fat. And I have found once people lose the belly fat, and I've been putting patients on keto diet for way over a decade, and I find that once they do the healthy keto, now we have a very healthy keto diet, which is a Mediterranean keto diet. And once they do that, generally the belly fat is burned off, and most of my patients that follow that for at least 3 to 6 months will burn off the majority of their belly fat, and usually their acid reflux goes away, usually, okay? The other thing is age. As a person ages, their muscles are not working in unison, and they have an increased risk of acid reflux as we age. The other is this is major, guys, consuming too much food at dinner and eating too late. Now, just listen to this. When you fill your tummy up at dinner with a huge dinner and you go to bed 1 or 2 hours later, all of that food's been sitting in your stomach, and then it starts to come up, and that little sphincter pops open, and all of a sudden that acid's coming up, and then all of a sudden it's dumping in your lungs, and then you wake up with a cough. So what you have to do is eat smaller dinners and do not eat within 3 hours of bedtime, so that food exits your stomach, so that you're not getting reflux. Real simple.
If you would just have a cutoff time that you don't eat past 6 o'clock,
Right.
that one thing people would lose weight.
You're right, Mary. Now,
Period.
Mary, you eat usually around 5,
Right,
and then we go to bed around 10.
right.
And so you don't ever have any reflux. Plus, you've
No.
lost all your belly fat. Most.
Exactly.
Okay. Now, the other thing, there are 4 key foods and beverages that cause the sphincter, the lower esophageal sphincter, to open up in everyone. I don't care who you are, even if you're normal weight. These foods are, number one, caffeine, especially coffee, because coffee's high in caffeine. You can still have coffee, just don't lie down after you drink coffee, or else that sphincter is going to open and you're going to get reflux. So after drinking coffee, stand up, sit up, but just don't lie down, okay? Now, if you do, lie in a lazy boy, so you're still at least have a 30-degree angle, so you're not going to get reflux. The other beverage that causes reflux in everyone is alcohol. And so many people are drinking that glass of wine at night because it relaxes you, but you're also relaxing your lower esophageal sphincter, and you're getting reflux. And alcohol makes you gain more belly fat, so you're getting more reflux. Then don't sleep well, so you get more fatigue. So it's a vicious cycle. So again, I don't recommend alcohol at night. Why? Because you're going to get reflux, okay? The other food that does it, that a lot of people don't like this, but it does for most everyone, is chocolate. The darker the chocolate, the more reflux you'll get. Now, you can have a little chocolate, but if you're getting reflux, you're going to have to elevate the head of your bed about 30 degrees. Now, this is another major one that causes reflux.
Okay, so you elevate the bed.
Well, hold on.
You
I'm talking about the 4 foods that cause reflux in
I
everyone.
know, but you need to elevate your bed.
Right, exactly. But here's another. The 4th food that causes reflux in everyone is peppermint, spearmint, either peppermint candies, peppermint gum, spearmint
See, and
mints.
so many people go to dinner, then they pick up
Yeah.
that mint, and they're eating that mint after dinner, those
Exactly.
after dinner mints, and then they're getting reflux, and they don't know why.
And exactly. And spearmint and peppermint, even peppermint patties, and you shouldn't be because you're getting the chocolate and the mint, they cause reflux in everybody because they loosen and they relax that lower esophageal sphincter, open it up so the acid comes up. So what you need to do is not eat. Now, you can still have a mint, just don't have it in the evening or you're going to get reflux. Now, for many people that have reflux until they lose their belly fat and stop eating these 4 key foods that cause reflux, they may have to elevate the head of their bed 30 degrees. 30 degrees is the key. How do you do that? Well, you can get a wedge if you want and put under your mattress, or a simple way, just go to Bed Bath & Beyond and get those little bed blocks and just put it on the head of the bed. Or you can get one of these adjustable beds, like a Tempur-Pedic adjustable, where we have a little electric control. It'll raise the head of the bed about 30 degrees. That's all it takes, and boom, reflux gone. Reflux be gone, okay? So those are the main foods that relax the sphincter. Now, there's other foods that are also triggering reflux in people commonly, but they don't pop the sphincter open. But it still can, not like those 4 major foods, okay? And these are the ones. Garlic and onions are a major reflux food for some people. You know it. If you've eaten a lot of onions, a lot of garlic, and you're refluxing, you've got to limit these foods. Another is citrus. It can be lemons, limes, oranges, grapefruits, but citrus, and a lot of citrus will do it. You say, but I just squeeze one little wedge of lemons in my water. Well, in some people, that's enough to cause reflux. Another major is eating fatty foods. Any kind of fat can cause reflux in patients. It can be too much olive oil at night. Now, I love olive oil, but if you eat a lot of olive oil at night, a lot of avocado oil, a lot of nuts, a lot of seeds, a lot of butter, cheese, cream, coconut oil, fatty meats,
Potato chips.
yeah, fried foods, you're going to get reflux. And what are those onions that they serve at those steak restaurants, those bloomin' onions? Oh my gosh, that's a reflux food. That's a reflux nightmare. Eating fast foods, they're usually fried and full of fats. Fried chicken, French fries, full of fats that cause reflux. Also, spicy foods like tomatoes and peppers are common reflux foods. A biggie is eating too rapidly. Now remember, to prevent reflux, you need to eat slowly. Put your fork down between bites, chew every bite. I used to say 30 times. You can forget
don't
it.
drink cold beverage with your meal.
Right, but you're supposed to chew minimum of 20 times. I used to say 30, but no one does that. So I say just chew 20 times, and that's fine. It'll prevent reflux. Yes.
But drinking the cold beverage, what's amazing is people have to understand when you're eating, you're heating up your furnace that is supposed to digest your food. And then you turn around and drink something ice cold.
Well, the other thing,
you're putting the fire out.
If you're drinking a lot of fluids with your meal, you're going to probably reflux. So you want to minimize your fluid intake with your meals, and especially your ice fluid intakes. A cup is okay. It generally won't cause that. Now we're going to talk about
temperature is better.
It is better, but we're going to talk about things that help reflux, and one thing is alkaline water. But you don't want to have alkaline water with your meal.
It'd make you sick.
Well, you can't digest as well.
Right.
So again, but people that have, some of my patients with reflux, if they're having it, they'll take some alkaline water, and it's amazing how it quenches reflux for some patients. But we're talking about still the problem, the things that trigger reflux. One of the major ones is lying flat in bed, like I talked about. When you lie flat in bed, especially if you've had a big dinner or some of these reflux foods, or if you've had coffee, alcohol, chocolate, or mints, you are going to get reflux. So you got to raise that head of the bed. 30 degrees is the key. Medications, guys, women, men, medications cause reflux. A lot of heart meds can cause reflux. Men, Viagra can cause reflux. Non-steroidal anti-inflammatories can cause reflux. Smoking causes reflux. Stress causes reflux. The major thing for causing reflux is Spanx and girdles. Women, get them girdles off, or else you're going to have reflux, okay? Especially in the evening time. When you're eating and you're at a restaurant and you got that girdle on, guess what? You're going to be reflux, and you got to loosen that thing up, or else you're going to reflux up. Now let's talk about what to do if you have it. Here's the key things. Number one, eat smaller meals at dinner time. That's the key. Eat your dinner at least 3 hours before you go to bed. And that's one of the most important things you can do, as well as take smaller bites and chew every bite at least 20 times. Chewing gum, chewing sugar-free gum, or I like the xylitol gum because it prevents cavities. After you eat, it literally helps keep the saliva running downhill and helps prevent reflux. That's a simple little thing that a lot of people do. Another supplement that works really, really good for reflux is called DGL. D as in dog, G as in go, and L as in lean. And I give them a chewable DGL with mastic gum. You get these online, they're cheap, and just chew it, and one or two, and it literally takes care of most acid reflux. Another, and probably the most important, is losing the belly fat. Something else that helps with reflux, aloe vera. Aloe vera helps a lot of patients, as well as apple cider vinegar. Now, this is amazing for some patients. For some patients, it makes it worse. So you start with a teaspoon of apple cider vinegar, and you put it in 4 to 8 ounces of water, and you can go up to a tablespoon in 4 to 8 ounces of water, and you do it usually either before or after meals, and it helps reduce a lot of patients' reflux symptoms. Now, there's also these gummy apple cider vinegars that you can get at Walgreens, Walmart, like Goli, yeah. And some patients swear by this. It works. It helps some patients. Just chew
until you lose your weight.
Yeah, until you lose your weight. Exactly. Now, let me tell you a story about a patient that comes from Africa. He comes from Africa. He came here a couple of years ago. He had severe reflux. had seen doctors in Africa, had seen GI doctors here in the U.S. He finally came to me. He said, I read your books, and so I wanted to come see you. And this was a couple of years ago. He came in, and
Yeah, your patients come from all
yeah,
over the
came from
world.
all the way
People
from
don't
Africa.
realize that,
I know. But
yeah.
anyway, when he came in, he was a slender guy. He had none of the characteristics of reflux. He was slender, had a slender waist, about a 32-inch waist, and he looked real healthy. He was about 50, and the guy was in really good condition. Blood pressure low, not on any medicines that would trigger reflux. And I checked him, and lo and behold, I checked his hiatal hernia reflex, and it was positive. So what I did is I pulled the hiatal hernia down with a special instrument I have with a percussor, and then his T7 on his back was out of position. It was subluxed, or out of position. And so I put it back in position with a little adjuster machine I have, and then I taught him how to do this postural stretch to bring his shoulders back in order to keep that T7 in its proper position. Because I found that he would come back to me because when it'd go out of position, his acid reflux would return. So I taught him how to do this stretch where he would pull his arms back and pull his shoulders back and then twist his arms out. It would pop that vertebra back in position, and every time it did, his reflux would stop. And he went back to Africa, but when it went out of position, the reflux would come back on. So he'd go to his doctors. They said, I've never heard of this. So he'd fly back to the U.S. when it would go out, and I'd have to put it back in position.
Boy, that's an expensive
Exactly. So
adjustment.
finally, we got him where he was trained. He could do it himself, and so now he's doing amazing. And he also had H. pylori that we found and helped clear that up. So now his gut is fine. He has no reflux. And it's just by doing this simple little maneuver that we did and taught him how to do it. And now he has no problems with it. So it's something that simple that he was able to do that literally stopped it.
So for those of you listening and you don't have a weight problem and yet you have reflux, these are some great advice things that possibly you could do and learn to do, or maybe make an appointment to see Dr. Colbert and come. Because I know, Dom, that also with some of your patients, I've watched you do this procedure.
Right. We pull the hiatal hernia down.
You pull it down,
right.
and then that gives people relief.
Oh, it's amazing how that little, and I had to do this on this gentleman from
Yeah.
Africa, and
Right.
but once we did it a few times, it literally held.
It held.
And again, I see him maybe once a year now. He used to fly over every 6 months for me to fix him,
Wow.
but he's doing amazingly
That's
well.
good.
Now, one other little caveat, like we talked about the licorice or the DGL, regular licorice won't help, and that can raise your blood
You
pressure.
mean the candy
Right.
licorice?
No, not the candy, the DGL. This
Okay.
is, you can get that online,
Oh,
or
it's
you
a
can get it at the health
supplement.
food store. It's a
Okay.
supplement that helps. The other thing, believe it or not, is melatonin. Your intestinal tract makes nearly 500 times more melatonin than the rest of your body. And so melatonin can also help with acid reflux in some
Wow.
people. And just start with a low dose, 3 to 5 milligrams. And it's amazing how a study found that melatonin was effective in reducing reflux in some people. Okay, it helps to reduce that LES pressure. So amazing, simple little things like that work the best. But the best thing for reflux, losing the belly fat. It is amazing how the best way to lose the belly fat is following, I believe, our Mediterranean keto diet, which is beyond keto, and then minimizing those foods that do it. The worst foods, again, are your caffeine, mainly from coffee, your alcohol, your mints, especially peppermint and chocolate. Now, again, I'm not saying stop chocolate. It's good for you, but not a lot of chocolate at night, because the darker the chocolate, generally speaking, the more reflux, especially the more
It's
you
just
eat.
better to do
But
it earlier.
Right,
So
exactly. That's the key.
whole key.
But that's it. It's so easy. We help so many thousands of patients overcome acid reflux, and it's so easy. And
Now,
hopefully
do you
this.
have any of this information in your Bible Cure for Indigestion?
Yes,
Which is
I
the same
do.
thing?
And I also have some of this in my book, Dr. Colbert's Healthy Gut Zone. And this is something that is epidemic in this country, and we're going to be seeing a whole lot more of it because America's getting fatter.
I know.
The more belly fat we get, the more acid reflux we get. It just happens that way.
Now, there's no way we can put all the information on this one podcast. That's why it's important to get a hold of the books, because he goes into detail and tells you how much and where and all that good stuff. So be sure and go to our website, drcolbert.com, and it's Divine Health. And you can watch videos and listen to the podcast. And please, whatever you do, share this information with people that you know. Be sure to share the podcast. We appreciate your partnership in helping us get this wonderful, life-giving information, because it's God's desire that you walk in divine health. That is His will. That is the will of God, that you walk in divine health. I'm telling you, He doesn't want to, He's not a child abuser. He doesn't teach you lessons by making you sick and giving you diseases. That is not God.
Mary,
That's the devil.
acid reflux is so easy to fix. It's so simple. The key thing, I really have seen so many thousands reverse this, and the main thing is losing belly fat. The easiest way to lose that belly fat is follow my Beyond Keto program. It's in my book, Beyond Keto. It works.
Yep.
And as that belly fat goes down and you avoid those acid reflux triggers, it's so easy. This thing
You
is
know,
easy to fix.
the thief comes to kill, steal, and destroy, but Jesus said, I have come that you might have life and have it more abundantly. It is God's will to bring you life and health. And you know what's amazing sometimes? We want to blame the devil for everything, but many times we're just doing it to ourselves.
It's the flesh.
It's
and
the
I
flesh.
find usually the very food you crave is the very food causing your problem, your health problem. And
So there you go. You
so-
gotta take care of your garden.
right, and remove the thorn and your body will heal. I've told you all the thorns that trigger reflux, and the main thing is the belly fat. But when you burn that belly fat off, the vast majority of my patients overcome their acid reflux. It's that simple.
And you know what? I believe in you. I believe you can do the right thing, make the right choices, and be the best you that you can be. We pray for you. God bless you.
God
Thank
bless
you for
you.
listening.
We'll see you next time.